Today, in this Ask the Author session, I have the pleasure to host Professor Michel Ducreux, who will present the results of a follow-up analysis of the IMbrave 150 trial entitled Efficacy and Safety of Atezolizumab plus Bevacizumab against Sorafenib in Hepatocellular Carcinoma with main trunk and/or Contralateral Portal Vein Invasion in IMbrave 150. Dear Professor Ducreux, first, congratulations to you and your co-author for this publication. Can you tell us what is the background of this analysis?
The background of this analysis is a subgroup analysis of the pivotal trial that has shown that a combination of atezolizumab plus bevacizumab was really much more active in terms of response rate, progression-free survival, and overall survival than the previous standard of care of the patient with hepatocellular carcinoma, advanced hepatocellular carcinoma, that was Sorafenib. The particularity of this analysis is that this is a subgroup analysis, as you said, of patients with main trunk and/or contralateral portal vein invasion.
Very good. So what was the methodology? What are the number of patients you had in this trial?
It's really a post-hoc analysis, so it was not planned to do this analysis at the beginning of the study. But the fact is that the IMbrave 150 is the only one study that allowed this type of patient to be entered, especially patients with a main trunk obstruction due to liver carcinoma. So at the end, this subgroup analysis included a little bit more than 50 patients in each group to evaluate exactly the efficacy of this treatment.
So what are the results?
The results are showing really that even when you have this kind of extension of the disease that is really a problem of poor prognosis, you have an improvement when you are giving to these patients the combination of atezolizumab plus bevacizumab, with an advantage in terms of overall survival, 7.6 months in the atezo-bev group versus 5.5 months in the sorafenib group. And there was also an improvement in terms of progression-free survival, 5.4 months versus 2.8 for patients receiving only sorafenib.
So how do you see these results impacting on the selection of the systemic treatment in patients with unresectable HCC?
It means that really this new standard of care, that is this combination of atezolizumab plus bevacizumab, is working across all the subgroup of patients. And so there also in these patients with a poor prognosis and invasion of the main portal vein. And this is really a new standard of care also for these patients with a poor prognosis.
Thank you very much, Professor Ducreux, for having so well summarized this publication.
You're welcome.
Be part of the future and join our fight against liver cancer.